The American Red Cross is sounding the alarm because of an emergency blood shortage.
Yeah, donations have dropped sharply since late May, leaving hospitals with a growing gap between the blood that they have and the blood that their patients need. Andrea Miller is with the American Red Cross, joining us now. Good morning.
Good morning.
Thank you for being here, wearing your red. We've heard about blood shortages before, but what makes this time so much more urgent than in previous times?
Well, right now we're in a blood crisis. This is only the second time the Red Cross has declared a blood crisis. The blood, in June, we had a 25% decrease in donations. So it's a significant issue for us.
I know it's not good, but I do want to ask what happens when there isn't enough blood available for patients? I mean, what happens then?
Doctors have to make some serious choices. Things like elective surgeries may be put on hold. Type O blood is the most common blood. That's where we're seeing the biggest shortage. And so for trauma, other emergency centers, that's a serious issue.
And so, of course, we want people to help, right? So how can people get involved? How can they host their own blood drives? Give us all that information.
Sure. They can go on redcrossblood.org and make an appointment today. Even if there's one not available, we need people to make appointments weeks coming up so that we make sure we have enough blood on the shelves. They can also call 1-800-RED-CROSS to schedule that blood drive or that appointment. Organizations from churches to community centers to businesses can schedule blood drives to be hosted in their locations.
I feel like we're correct in saying that summertime is usually the most difficult time when it comes to getting blood donations. And I know that you guys have your reasons for that. I would think summer vacation would be one, but what are some of the other factors that make this every year a critical time of year?
Yes, you're right. Summertime is a difficult time. Kids are off from school, people are on vacation. Trauma centers are seeing a higher need because of some of those summertime accidents that happen. But this summer in particular, we're seeing things like extreme heat, air quality, things like the foodborne illnesses are really keeping people at home and not in those blood donation centers.
And if somebody wants to go donate their blood, but they just don't know what to expect, can you kind of walk through what the procedure is, how much time it would take?
Sure. Our blood process can take about an hour for that first-time donor to get registered, go through the health screening. For whole blood, it's a quick 15 to 20-minute blood draw. We have something called Power Red, which really saves lives. It takes a little bit longer, but it's much more of an impact, more blood drawn for those emergency needs.
We want to say everyone can help out, but there are some restrictions, right? I mean, not everyone can help out in this situation. Can you talk about that?
Yeah, there are a lot of maybe medical issues, people that have had other circumstances in their health history that just restrict them from being able to donate.
And once again, if somebody wants to donate, where can they go?
They can go to redcrossblood.org or 1-800-RED-CROSS. Just give us a call.
That is the message, though, this morning. If you can help, please do help because the need has never been greater. Andrea, thanks for joining us here this morning.
Thanks for having us.